Hi, my name is Dr. Raja Adnan Ahmed, and I am a consultant psychiatrist currently working in UK. And with me today is Dr. Abdullah Basi, who's a ST trainee in gastroenterology. A lot of IMGs ask me that what is the future of a core medical trainee or IMT trainee? Because there is an impression among IMGs that IMGs don't get uh, subspecialties of medicine. A lot of people believe that IMGs can only get acute medicine or care of elderly. So I thought this would be a good example for us to get to speak to Dr. Abdullah Basi, who's actually an IMG who came to UK in 2016. He's a graduate of Rawalpindi Medical College from Pakistan, and he is currently working as an ST doctor in gastroenterology, training to become gastroenterologist. Hello, Abdullah. How are you?
Assalamu alaikum, Nan. Thank you very much for the opportunity. And before we start, I would really like to appreciate you for taking the initiative from your own personal time over the weekend and doing this for public. So that's absolutely great initiative, like you always do.
Thank you very much. But this is very important for us to understand, especially the IMG community, that what is the future of a core medical trainee or IMT trainee, and how to really use that time to improve their self, so they can apply for the specialties they're aiming for. So specifically in terms of gastroenterology, do you have any tips, or can you explain to us how you got there?
So thank you. Basically, as you said, I think it's a myth that gastroenterology or cardiology or any other comparative specialty is not for IMGs. Me and quite a few of my friends, we applied for multiple specialties. One of my colleagues, he applied for cardiology, renal, gastroenterology, got all three posts and chose gastroenterology. I applied for respiratory, acute medicine, and gastroenterology interviews and secured all three and got gastroenterology. So it's all about one word, and that is planning. In your interview or in your job application, there is no difference between an IMG or non-IMG doctor. It's all very structured, very organized. I think the place that we struggle is that a lot of IMG doctors or core medical trainers are now new IMG doctors or IMG. They make decisions at a bit later stage, and that is when you struggle about how you will go about it. For example, if I take you through my gastroenterology training or how I applied for it, in start of my core medical training, I knew that gastroenterology would be my first preference as a job, and I would keep respiratory as my backup. At that time, what I did was I went into the ST3 recruitment website and I looked at all the points that you score in your interview. So those things are if you have any additional degrees. Now, when I was core medical training, I was not going to get any additional degrees. So that's pointless for me to try to achieve that. Then there was points of a quality improvement project. So that was something I could easily achieve. So I started doing quality improvement project in start of my core medical training so that by end of my core medical training, I could have completed it and presented it somewhere. The next section was regarding MRCP. As everyone who's doing core medical training or IMT would know, you have to complete your core medical training, including PACES. And my suggestion in that would be to aim for the time of application rather than end of your training. Because if you have got your complete MRCP by the time you apply, then you get maximum points. Otherwise, you don't. So I would aim for start or when you're applying for core medical training rather than the end. Other things which are important is research publications. Now, this is where I've seen IMGs struggle quite a lot because we make it very, very complicated. And we think that the only way to do a research is to take a personal initiative and do the data collection and then sort of go about it. That's not the only way, as we will discuss a bit more in the later section. That one way is you can contact few colleagues or registrars or consultants who are research oriented in your specialty, and there are always projects going on, so you can get involved in those projects and come out of it as a co-author, which would count or which will give you points in your core medical training, which is what you need. So you don't have to make it very complicated. You can do it by putting in hard work and effort, by doing it in a simpler way. And the other is things like national posters or national presentations, which again, if you plan initially, do some work, send it somewhere. So by end of that year, you'll be easily able to achieve those points. So the first thing is to plan your application right from the very beginning, see what you can achieve and see what you can't achieve. Um, and the last thing in this application, which is very, very important, which doesn't have points interestingly, is commitment to your specialty. For example, how can I show that I'm committed to gastroenterology? So few things that I did, which does not take any effort, which are very simple things. I went and even when I was not doing a gastroenterology job, attended different multidisciplinary meetings for gastroenterology, so MDTs. And I got my certificate signed. I got my attendance sheet scanned, part of my application, showing that I'm committed to gastroenterology. I became a member of British Society of Gastroenterology, which only cost me £15 a year, but that showed that I was committed. I attended various online free teaching sessions for gastroenterology. Apart from this, attended few conferences. So even if you don't attend conferences, there are a lot of things that you can do before this at your hospital level, be it in cardiology, be it in gastroenterology, be it in dermatology, any specialty that will show that you're committed to that specialty. So it's about having a structure, knowing how you're going to score maximum points, and showing commitment to the specialty. And this does not happen in a couple of months, or I would say in 4 or 5 months. You have to spend time from it right from the very beginning. Plan yourself as you go along. And then at the end of the day, you would be in a stage where you will easily be able to get your desired job.
That's very nice for you to explain the process and how you did it. And you're right, you don't need to start planning from the day one of your job and look at the person specification of the next job which you are planning to apply next training level. This is something I also recommend to my psychiatry training as well. Can you tell us about your experience of the interviews itself? How did that go? How did you find it? And is there any advice of people who are going for that level of interview? How do you?
So you're absolutely right. No matter how good you are in pre-interview score, interview has much more weightage. So I can speak of some specialties include gastroenterology that your interview score weighs sort of almost double than what it is that you have pre-interview score. So even if you are very, very good on paper, they want to see how you are in person. There are 3 stations for gastroenterology interview. First is a station where they see your portfolio, they talk to you, and simply by talking to you, asking about your portfolio, asking about your future, asking about your specialty, they would know how committed you are and what you have shown on the paper. Is it something that you have requested someone to put your name on it, or is it something you have actually done? Because when you start talking about your research papers, when you start talking about your QIP, the person who's sitting in front of you has been doing this for many years, and they can easily judge how committed you are to that. So the first station is commitment to specialty. Apart from knowing complete ins and outs of your portfolio, you can read, there's an ST3 guidance book. You can skim through it, but this interview station comes from your heart really. The specialty that you are in, do you know what is going on in that specialty? Do you know how that specialty has consultant jobs? For example, if you're going for cardiology, you would be expected to know that to get a consultant job, you have to do MD, PhD, those kind of things. And if you've got any special interest, for example, especially in gastroenterology, one of the questions that they asked me is when I went to a first station, they said, we've seen your CV, we know you are committed. They talked to me about portfolio actually. They talked to me about core medical training, and they talked to me if I think reflection is a good idea or it's a waste of time, which is something you can't prepare for. But it is something in general that if you're committed to your specialty, you would know. But then they asked me that if I know what is new going on in my field. So what is the thing that I think, and not just new, but what is the thing that I see in gastroenterology that is going to change the specialty in a significant way, and how do I feel about it? So I'd read a couple of research papers regarding alcoholic hepatitis. We discussed that. So that went well because I knew that this is a common question that they're going to ask. And if you're committed to your specialty, you would know this. So that is the first station. The second station is where you are asked 2 clinical scenarios. One clinical scenario is about hepatology, and the other clinical scenarios is about luminal or other part of gastroenterology. Again, nothing complicated. They don't want you to give consultant level answers. Literally like PACEs, they want you to have a structured approach. You would take history. What are you going to ask in history? Make sure you ask basic things: past medical history, social history, keep patient first. What's your basic management plan? And then the more you tell, the more they go along. One of my stations was about alcoholic hepatitis, and the other station was about flare up of ulcerative colitis. Both things very commonly seen on acute medical take in all IMTs, core medical training, or even non-training doctors who have been in the UK come across this scenario multiple times. But it is about knowing that you need to have a systematic approach, knowing that you need to go from the basic history, parts of history, examination, investigation, then diagnosis. Before even going in the station, I knew what the diagnoses were because they give you a scenario and you can predict the differential diagnosis. It can be very few things, but that's not what they're interested in. They're interested in your approach and knowing that if they are your consultant, would you be a safe person to run the take overnight as a medical registrar? And that's what you need to focus on. So that was my second station. The third station was where you can either present an interesting case or you can discuss a recent research paper. Now, I mean, the safe thing is to discuss a case because no matter how good you are in presenting a research paper, those guys know much more than you about it. So you unless you are very, very well versed about it, that's not easy to handle. So I went safe. I discussed a case. Again, that case does not need to be something which is out of this world or which is a very rare thing. My case was simply common bile duct stones, but it was a very unusual presentation in a young gentleman who initially we thought had cholangiocarcinoma. And that patient actually did not speak any English. This was around Christmas time. So we had a lot of problem with communication and telling a young guy that you might have a cancer against, might you have a stone, and what investigation he needed wasn't very easy. So the aspects from learning from that was communication, his management, thinking the best for the patient, and how to arrange these investigations in a difficult situation, especially around Christmas time and things like this. So it's a very common case. It's not something that that any person who's done gastroenterology won't see, but it's about how you present it and what are your take-home messages. And this is the interview section. I'm sure some other specialties would have their different interview structure, but I think that if you stick to these basics, if you have a systematic approach, if you prepare for it properly, one thing that helped me immensely was speaking to people. So when I knew I wanted to do gastroenterology, I started speaking to consultants even when I was not doing gastroenterology. I would send them emails, I would call their secretaries, set up an appointment with them, and go have a chat with them. Tell them that this is what I've done. What do you think I should do more? And they told me smallest of the things, like coming to MDTs, coming to endoscopies for a couple of times, reflecting on that, and then putting that reflection in my portfolio. Smallest of the things that don't need any booking, that don't need any money, that you can just do. These things are happening in your hospitals all the time without you realizing it. So that is one thing I did. The other thing that I did was I prepared my portfolio sort of a couple of months before my interview. And then I would set up time with my consultants and I would take my portfolio to them and I would ask them to interview me. They would ask me things that I absolutely would not know at all, but I would rather have that beforehand than in the interview. So that made me think, okay, this is the other part of the interview that I need to focus on. I spoke to a couple of registrars who were extremely helpful. They did mock interviews for me. And I think this is something that can be used for IMTs who have been applying their first job. If you're applying for your first job, you can always request to your friends, colleagues who are already in the system for 6 months to just do a mock interview for them. It's just about putting in effort because A, it will give you confidence. B, you would know what are the common questions, because in your mind, you always have answers to those questions. But when someone asks you those questions, then you don't know how to formulate those answers. So that was the other helpful thing that I did. And the third was speaking to some extremely helpful registrars, right, and staying in contact with them right from the very beginning of my training, who took me through the whole process, who took me through the application process, who took me through my portfolio process, and who helped me immensely with research and publication. So I think that's the way to go about it for interview, for preparation on the day of the interview, and for preparation before the interview as well. And last thing is that you really should go in your specialty, like you mean to get that specialty.
Yeah.
You need to be well dressed. You need to be punctual. I've seen few people who are in the interview, IMGs as well as non-IMGs, who are very casual. They were wearing sneakers when they came for the interview, not wearing tie. Their portfolio wasn't organized and things like this. This actually means that this is probably your second preference specialty. You're not actually into this specialty that much, because at the same time you would have people who are there, ready, well dressed, structured portfolio, and when they do the comparison, although this is not something they will score you for, but naturally as a human being, they would know that probably you are less committed to that specialty as compared to someone who's probably not as good a doctor as you might be, but who hasn't put in that extra effort to get ready on the day when it all matters. So I think that's the other point that I would like to focus on.
That's very helpful tips. I think you've touched on some of the very common things which we should be doing. It's not just for gastroenterology, that's valid for any specialty. Understanding the person's specification, doing some practice, doing some homework prior to going there, and then on the day to appear very, as you said, ready for the interview and job as well. So have you got any tips generally for IMGs, or especially for the IMT trainees who may not be interested in gastroenterology, but they were thinking of some other subspecialty? I think you've already shared a lot of things, but is there anything else you want to add, that how should they sort of go about it?
I mean, the most important thing I think that I would say is, and where we lag slightly as an IMG, even I speak for myself, I felt I was lagging, and a few of my other colleagues, is that you should not waste time at all. And I know our parents used to say it all the time, and it would annoy me very much, but I'm saying it now. And when I say this, I mean that you need to utilize your time properly right from the very beginning. So from your start of IMT, see what are your do's and don'ts. For me, my do's and don'ts were I wanted a specialty where I can do subspecialties, as well as where I'm always on my toes. So I'm not sitting around. I'm doing something, and I wanted variety as well. So gastroenterology, cardiology, or respiratory for that matter were natural choices for me. Some people don't have that interest. Some people want a very clinic-based specialty, maybe dermatology or diabetes endocrine, those things. So my first point would be, see what are your do's and don'ts in life. What would make you happy? And what are the things that you absolutely cannot tolerate? And based on that, narrow yourself down to one or two specialties and start working towards it. Because IMT or is very busy, or even a non-training job is very busy all the time. You're working from 9 to 5 all the time. You're doing on calls. Then all of us have a life as well. And we've got very busy social lives, to be honest. So it's difficult to accommodate all that. So try to see how you can best utilize your time. The first thing is deciding your specialty. Okay, you've decided your specialty now. Now, if you're IMT, you want to get into an ST. If you're a non-training doctor, you need to decide if you want to get into IMT or ST. Then you have to see how much time do you have. For example, if you're IMT, you know that you've got 2.5 years. So just make a plan about when do you want to take your part 1, part 2, and PACES, and how much time would you have in between to do few other things. For example, I would everyone knows that once you're on the ward, you're doing your jobs. When it's not a busy day, you do get sort of free around 3 or 4 o'clock sometimes, and you have got that extra half an hour, 1 hour, where you're not doing anything. Probably get a cup of tea, and it's not always the case, but sometimes you do get time on your ward. What I would do is, rather than putting any extra time, I would go half an hour early to work and do all the data collection and everything else that would have. This way, I don't have to put a lot of effort, and I'm still utilizing my times doing extra things. So the second thing would be, know how you're going to plan your application and utilize your time. The third thing that I would suggest, and again, this is something that I feel I'm learning as well, but we all lag a bit, um, is, is how to share and how to get other people involved in the project. So let's say if you're doing a quality improvement project, we don't have to take all the responsibility on ourselves. You always have very helpful F2s, F1s, even other trainees who would like to help. So you can get involved in their projects and they can get involved in your projects. No one is going to cut you a slack if you don't work hard or if you're not putting in effort. People will have go their own ways. But if you dedicate, then that would help you with new ideas, that would help you with time saving, and you can get involved in more than one project. So if you're involved in their project, they can get involved in your project, and this does not need to happen in your own hospital now. Especially when you come at a registrar level, for example in gastroenterology, there are registrars who are doing projects in London, but we are being part of it as a trust and as a hospital. Similarly, you have got projects going on all over the deanery, nationally, even internationally. You can have projects going on where you would do some work, come up with your ideas, and there are people who would help you. So this would be my other sort of suggestion. I mean, it's going to sound bizarre, but in COVID time, I've noticed that there's a lot of medicine and gastroenterology that goes around Twitter as well. Very important discussions. For example, for gastroenterology, they use GIT Twitter hashtag. You will find people from all over the world. You would know what they're doing. And I know someone who went into their radiology training, and all they talked about is in 5 minutes is what they found on Twitter. So they started talking about how they came across radiologists from Canada, America, even UK, different settings, what they were doing, what were the new things. And there, the person who was taking the interview wasn't using Twitter and was very, very interested in that and wanted to know. And they kept on talking about it. And this was their commitment to specialty, because you have made that extra effort to go in and see what is going on in your specialty. If let's say I'm not interested in a specialty, I'm not going to make that extra effort and do it. But if you are, you would do it. So this is the other thing that I would say, is that dedicate as well as be smart. Make sure how you can spend minimum time and get maximum out of it. And the last thing that again people struggle with a little bit is leadership. You have to see how you can develop yourself in a leadership roles, and that doesn't leadership here doesn't mean bossing people around. That means taking a bit of responsibility, but in a good way. For example, you always have medical students coming in. For one of things that I sort of showed in leadership, and I talked about in my interview, was I saw that there were medical students coming on my ward. So I emailed my consultant saying that I want to arrange a couple of teaching sessions with them. And she said yes. She was very happy. So I taught those medical students. They gave me feedback, and I put that feedback in my portfolio that everyone does. But what I went to the extra length to get a leadership thing was I printed the email that I had sent to my consultant and printed her reply and put it in my portfolio. Now this shows that you have got that leadership quality of taking an initiative, that you went out of your way to initiate something and then acting on it. So similarly, even if you're talking to your registrars about projects, even if you're talking about your other juniors, you are taking initiative. Then if you're a kind of person who wants to go a step further, there are things like associate college tutor roles that you can apply for, which means that you can get involved in arranging PACES teaching, in arranging other things. You can get involved with BMA, be local BMA reps and things like this. Even getting involved in your mess committees shows that you have got that leadership quality. It probably is not going to give you marks, but it's going to give you that extra thing that you can put on your CV and talk about. So I think what we as an IMG needs to do is stay positive, plan, come out of this bubble. Even if you're a non-training doctor applying for your first job or applying for specialty training, come out of this bubble that this is not for us. You can achieve anything here, be it gastro, cardio, dermatology, acute medicine, anything you want, that you actually are committed to it, that you actually have a plan for, you'll get it, inshallah.
Thank you for that. One of the things you mentioned, to involve others in your projects, it could be quality improvement projects or research projects. I just wanted to add, you mentioned the foundation doctor, the core trainees. I think you can also involve medical students as well. And some of my doctors, some of the doctors I work with, they have done this. All they need to do is to email the medical school and say, I am doing a project related to psychiatry or gastroenterology, whatever. And if have you got any students? I need 2 or 3 students to help me out. And they are extremely keen. They are full of energy. They'll come and sort of help you out, because they're always also looking for these opportunities as well. So you will always find people who will help you with your project. As you said, try and take some responsibility yourself, obviously take initiative yourself, but then try and make a team. That's a very, very good way of going about completing any activity you're doing. Abdullah, thank you very much for your time. I think this was a very, very good session, and I'm sure there would be a lot of questions on the comment box, and I will ask you if there are any specific questions around this. But I think you have given us IMGs a lot of hope that gastroenterology or other medical specialties are all doable, and we should come out of this mindset that this is only for British graduates or only for certain kind of doctors. If you work hard, if you plan ahead, and if you sort of think about it positively, there's always you will always get it.
Thank you very much for giving me this opportunity, and I absolutely second your thought that in all the interviews that I've been, and I've been rejected in quite a few interviews, I'll be honest with you, especially when I was applying for my initial jobs. You don't always get the job. I never felt that it was because I was a brown doctor, or I wasn't white enough, or I was British or non-British. It was probably when I reflect back on those things, it's probably I wasn't good enough for that job. I did not apply properly. I'm more than happy to answer any questions in the comment section. Otherwise, the last thing that I want to say is the same mistake that, because it all goes in the cycle, isn't it? Is what you would do as an IMGs if you have got a question about any specialty, be it from you, be it from me, be it from Umar, be it from anyone. One of the things is always do a simple Google research. I, a couple of years ago, 3 years ago now, gave a presentation in my home college, and the first slide that was there is what's going to give you most answers. It's Google. So if anyone has questions, what you would do is you would search for it yourself, because that again shows that you're committed to things. And if you still have questions, there are people who would help you. What I felt initially was a problem that I worked on later, got improved, is I would not put in that extra effort initially. I would simply ask people to spoon feed me and give me the basic information, which would annoy people initially, and that I would not understand, why this guy is not helping me. But what I realized at the end was that probably they not spoon feeding me was one of the best things that happened, because that gave me an initiative of going the extra mile, looking for answers myself, having a basic understanding, and then asking specific questions. So I think that's what a lot of IMGs can focus on, like myself. But apart from that, I'm more than happy to answer any question in the comment section, or if anyone has got any personal queries, they can inbox me, and I'll try to get back to them when I can. But again, as I said, thank you very much for taking this initiative. You've always been very kind. I've seen few of your videos regarding palliative care and other things as well, and I think you're doing excellent work. Taking time out of your personal time, weekend, it's not easy at all. So thank you for taking this initiative.
Thank you very much, Abdullah.